Hello, everybody. I'm Peter Grant from Zaner Metals in the Denver office. With me, my colleague Peter Thomas from Chicago, and our special guest, Dr. Ahn. Dr. Ahn, if you wouldn't mind giving us a quick bio.
Hi, good morning. Thanks for having me. I'm Dr. Ahn. I'm the Deputy Chief Medical Officer of a large international hospital system in Shanghai, China. By training, a critical care doctor. I'm an intensivist, and I'm also an anesthesiologist. Just for context, Shanghai is filled with about 27 million people. It's densely packed. And our first exposure with this new coronavirus, was about a month and a half ago. And during this time, we instituted a task force, which we were leading. And our primary objective was to screen and to mitigate cases from coming into our system, which we were very successful at doing. So hopefully I could share just a few tips about doing that in the workplace, but also just general tips about living and just good health around this time of coronavirus infections going on.
That'd be fantastic, Dr. Ahn, and thank you again so much. So, if you could go ahead and let's start really right at number one, the basics, which is most people know or think they know, which is just how do you wash your hands? What's the proper way to stop this virus from spreading on your hands?
Yeah, it's a great question. It's interesting because washing hands seems so basic, but especially with the purposes of getting rid of viral particles or bacteria contaminants on there, there's a very specific way that it needs to be done. And the first is get water on your hands. It sounds simple enough. Second step is to lather it up with soap or detergent. The third part is the important part. This is where all the action happens. You're scrubbing your hands. Don't forget the backs of your hands, in between your fingers, your fingernails.
Right.
And the timing is important as well, too. There's a lot of studies that show that the length of time is directly related to how clean you get those hands, how much bacteria and viral particles come off those hands. So it's recommended that it's about 20 seconds. And 20 seconds, if you sing the happy birthday song in your head twice at a reasonable pace, I think they'll cover it right about 20 seconds. Once you've done that, you wash your hands, get all the soap off, and then you dry it. And that's about it. So this is the process in washing your hands. And I think the reason why it's so difficult to do this properly is the context that it needs to be done. And that is if you're eating, anything around food, anything about going to the bathroom when you're near the toilet, if you're sick, if you're injured, anytime you get your hands dirty. So there's actually many, many times throughout the day, before and after, where you need to go through this process to effectively do that. Many people also find, though, that if they do effectively do this and they're washing their hands this many times a day, it gets very bothersome.
Sure.
Gets dry and cracked. And really the best solution for that is just a very light lotion. And don't let those dry and cracked hands prevent you from washing your hands. It's more important to wash your hands and address it with something like a light lotion if you really need.
Terrific. I think that's a great first start. So we're talking, and just in general context, that what we're interested also then would be what we really don't know is how long will this disease stay on surfaces such as light switches, doorknobs, things of that nature that are high contact areas. I mean, what can we expect the longevity of this disease to be on those surfaces?
Absolutely. So there's no definitive answer for that, but they've done studies, especially with this particular virus. They've noted that it actually lasts a long time on certain surfaces.
Okay.
So when we're talking about things like plastic and steel, common objects like doorknobs, light switches, we're talking
Right.
2 to 3 days. That's a
Wow.
rough estimate. Yeah, it's quite a long time. So
It is. Yeah.
it really speaks to the importance of washing those hands, because you just don't know what's been there in the past couple of days. When you talk about objects such as cardboard, it's been found to be as long as up to 24 hours. And that has many considerations as well too. When you're delivering and storing, and there's a lot of packaging going back and forth in certain industries.
Right. Right.
Even
Such as an Amazon or something like that has a great deal of paper going through it. So gloves would probably be very good for the individual.
Absolutely, yeah.
Okay.
And gloves and just, just that same habit of hand washing and personal hygiene over there. And, you know, metals such as copper,
Uh-huh.
a lot of times copper, silver, these things are thought to be protective. And really, the viruses have not been shown to last as long, but they last a significant amount of time, a few hours on the order of
Interesting.
that amount of time. So I think, again, going right back to the basics, we got to wash our hands. And, along with washing our hands, there are a few other good practices, good habits to
Okay.
get into. When you're coughing or
Uh,
sneezing, your elbow, your arm, just kind of
Absolutely.
blocking it so you don't spray and contaminate other surfaces for other people.
What is
Uh,
the effective distance that we can expectorate this disease? How far is it?
Yeah, so if it follows the pattern of other viruses in its class, then
Okay.
we call this droplet type spread, droplet
Right.
precaution. And that spreads at distance, large particles of up to 6 feet or roughly 2 meters, right?
Two
So that's
meters. Okay. Yeah.
perfect.
Gotcha.
When you get into certain industries or professions where it goes beyond droplet and what we call aerosolizing, it gets it into a fine mist, that's a whole different ballgame over
Hmm.
there. So I think that kind of warrants another conversation and a whole another level of protection.
Gotcha.
Um, I think that that's kind of the perfect question about the distance, because
Yes.
this when we go around in public and we're face to face, back to back, front to back to people in lines, and there's coughing and there's all these contacts that happen, we're really not maintaining that necessary distance that's required to prevent the droplet spread.
Right.
And
Right.
being very aware of that.
And when you're saying, because we deal with a lot of miners, a lot of people working in refineries, things like that. When people go down in mine shafts, in elevators and whatnot, I think this goes to the public recent thing that you referred to. What would we do in an elevator? How would we lay that out? Because obviously we can't pack 20 people in there coughing and sneezing and whatnot. What would you recommend for something that basic?
So it's interesting, and I think the short answer is it depends, just like everything else, right? So
Okay, sure.
um, ideally, you'd have one person go
Yeah.
in, one elevator, and
Yeah,
go down, come up, disinfected, and it's just obviously that can't be done. So
right.
um, specific to the elevator, certain things have been done, placing grids with tape, little dots that indicate where someone should stand to be at a reasonable distance. I
Let's
imagine.
so we could actually just put X's in the floor of the elevator so people would actually have their mark to hit when they got in.
Absolutely. I think
That's
that would give a rough idea of
okay.
an appropriate distance for that.
That's
And
fantastic.
it's very interesting actually
Yeah.
talking about the elevator portion, because when we talk about preparation for disaster management,
Okay.
preparation for pandemics such as this, there's actually there's a hierarchy of steps that you take, and some of these
Okay.
steps involve at the very top just eliminating the risk altogether,
Yeah.
and after that it's substituting it. Well, if we can't eliminate the risk, let's try to bring something else in, do something where that risk is not as severe, is not as prevalent. And these things at a certain point, you can do things depending on the industry. You can telework, you can
Sure.
call in and work from home.
Yeah.
Conferences like we're doing right now, if you're a miner, that's not going to be happening, right? You can't mine from the computer. So
Right.
once we and at a certain point, we may need to get into those, right? There may
Right.
be a point where some pause of operations may be needed, right? And that would eliminate risk at that level, right? But
Sure.
assuming that we continue with operations, we start going into how do we engineer controls, and
Okay.
how do we really make administrative controls and help people behave and work in a fashion that mitigates these risks. And I think that's kind of where we're going with the elevator, and then this is just a perfect example of that. And
Great.
things like locker rooms, changing areas, cafeterias,
Right.
canteen, how you even get back and forth to work, public transportation versus carpooling versus just personal transportation. These are all things where these behaviors, as a company, as a corporation, you can at a higher level help people make better decisions with it.
And getting into the upper level of management that you're addressing now, let's also say to our CEOs, COOs, general management that we're talking to right now, I think the idea that kindness and consideration will carry their company further than anything else. And if someone calls in and says, "Hey, I'm not feeling too good, and I'm afraid of losing my job, and I have to make payments on my home, put food on the table." I think a friendlier disposition to saying, "Hey guys, take that day off. Your job is still going to be here. Don't worry about it. We understand. We'd rather have a sick person stay home than infect an entire crew." Am I close on that?
Yeah, Pete, I think that's critical. And I think that message, that culture where an employee feels safe calling in from work, calling out of work, that
Right.
needs to be rooted very early on. That expectation needs to be set. Not only are you protected, but we don't want you coming in if you're sick because,
Yeah.
in some ways it is self-serving, right?
Sure.
You're looking out for your employee. That's of course that's key. But if you have a sick employee coming in because they're afraid of not getting paid, not being able to put food on the table,
Right.
having a coronavirus or having these symptoms, that's the least of their concern, right? Like they're coming in and they need food
Absolutely.
on the table today. And when that happens because people are afraid of losing their job and half your work staff get infected because of that,
Right.
um, something that should or could have been preventable early on.
Yeah. Okay. Great. I thank you. I appreciate that. Now let's go back to the elevator. We're talking about segregated spaces on the elevator for safety. What about in the natural workflow, which you touched on lightly? Let's say as far as a large locker room, and we have a mine, we have a refinery. Is there some type of dynamic that can be designed so that we have a smaller flow and maybe some type of disinfectant for the handles, for the water faucet, some type of arrangement that can be laid out for that?
Absolutely. So I think that, to your point, spacing arrivals,
There we
staggered
go.
shifts, even at the same shift, not having everyone rush in at the same time. To be honest, not everyone could get changed at the same time and get out that door at the same time anyway. So
Right.
just taking that as maybe the efficiency won't be as high at first, but then you can space people out, prevent more of this clustering, and give them the personal space that's needed. I
I
think that
understand.
a lot of times, friends and colleagues, they'll share supplies if they need to. This isn't the time to share personal supplies as much. And really, I think the key is disinfection, just being fastidious about disinfecting um, frequent intervals and using appropriate solutions to disinfect.
And oh, by the way, Dr. Ahn sent us a list, which we're going to attach at the end of this, of the appropriate types of detergent, things of that nature. Thank you so much for that, Doctor. We'll attach that at the end of the show. Now, let's talk. Here's something that we haven't touched on, and I think this is the same theme. What about if we have a centralized place to eat? We have a lunch hall or even a buffet system set up. How would we go about just what would the dynamics of that be, Dr. Ahn?
So I think lunchtime, the canteens, the cafeterias, these are almost sacred, right, for so
Oh, yeah,
many of us in work because this is our socialization time, right, and this is when really our human connections are made. And I think the difficult part during this time period is that lunchtime needs to be thought of as very utilitarian now. This is a time for you to get your nourishment,
right.
and this is not social hour anymore. This is unfortunately something that just needs to be strictly for the purposes of getting nutrition in and leaving. And the same principles and staggering shifts would apply over here.
I got
Um,
you.
Physically seating people. So instead of clustering
Ah,
around and having face-to-face of 5 to 10 people, you may need to have just people, if you remember these, you know, testing halls from a long time ago, just spaced out, everyone facing one way. It's very sterile, and it's definitely not conducive to socialization, but it's also less conducive to many people sitting around and communicating and possibly transmitting viruses. So it's not proven, but in this concept of social distancing and keeping a minimum amount of distance from people, minimizing risk, it's something that is a good idea.
But it seems like a small sacrifice for a lot. So we give up that a brief period of our life for that socialization, but in effect, we're not going to be contracting a disease. So I think that makes good sense. So we've covered how we get to work, how we transport down into mines, how we get into locker rooms, how we get our sustenance. I wanted to ask you something which would be important for the management. What about in the preparation of foods and the display of foods? Should the surfaces of vegetables, things of that nature, should they also be washed?
Absolutely, in the context of this novel coronavirus, there's
Yes.
concern that the virus is transmitted through the GI system.
Okay.
Meaning that secretions, stool,
Right.
microscopic bits over there if your hands are not completely clean. So the entire supply chain, the entire from procurement to the plate, the
Gotcha.
entire chain needs to be protected. This includes making sure that our cafeteria workers are excellent about keeping hand hygiene. Um, to your point, making sure the food is washed cleanly, and it's not, just as importantly, it's not put in a position where it can be compromised. So many places they have food,
Right.
for efficiency's sake, open and lying out, like you say, buffet style. So you
Right.
walk by, you have a
We
couple
refer to as a steam table display, right?
yeah, perfect,
Yeah.
exactly.
Right.
That's exactly right. And one person coughing or sneezing across that, one person who's infected
Every.
compromises that higher line. Yeah, exactly. So I think that putting up maybe a thin plastic barrier, and
Perfect.
someone reach around or having someone give that to you. Again, it's not as efficient as just grabbing it, but depending on what your background risk is, it may be something that's necessary.
No, that's brilliant. We could have the plastic with some slits cut in it, could hand the plate through. The food server who would be wearing gloves and is well disinfected, could take your choice out and then hand it through. No one's breathing or coughing or sneezing on the food. That's just great. Thank you. That's terrific. We'll make sure that this gets seen by those people too. So we've covered pretty much soup to nuts as far as getting to work, getting down to work, how to conduct yourself in the changing area, what to do in as far as the preparation and consumption of your meals. Is there anything that we have possibly missed or haven't covered for a brief basic overview?
Yeah, no, I think I think it was a good overview. Sometimes people wonder when I come home, what do I do? Do I
Ah,
need to wash my
excellent.
clothes? Do I reuse my clothes? And generally it's recommended wash your clothes, especially if, they're contaminated. Just generally good, I think, work clothes practice. And specific to this novel coronavirus, the
Uh-huh.
COVID-19, um, the recommendation is that you wash your clothes in hot water, 80 degrees or
Okay,
higher, and you try to use a bleach-based detergent. And
gotcha.
honestly, not all of our clothes are suitable for bleaching or bleach-based detergents, but
Right.
the important thing is you dry it well, you clean it
Okay.
well. And,
High heat is in the dryer, probably, I would assume, huh?
absolutely, yeah,
Okay.
yeah.
Okay.
And there's a list of detergents that the American Chemistry Council recommends. So
Outstanding.
send that over as well too. I
So,
think.
so what I think you're saying is that we should just go by the assumption that everything is contaminated. But by the time we get home, we've touched so many things. We've rubbed into things. If we're on public transportation, poles on our shirts and whatnot. So you might as well just take everything off and might as well just throw it in the machine if your spouse or family aren't going out, they're sheltering in place, maybe just wash that load by itself.
Absolutely. Yeah, I agree. I think one key thing to keep in mind is what the background is. And I think it's important in the sense of how companies react, the policies
Uh-huh.
they put in place, whether they keep operating or not. And, individually, how concerned and nervous we are too. So the background risk in some place where you just don't have really many cases at all, I think sometimes enacting a lot of measures may not be the most efficient use of resources. There may be other things that are more concerning that you may need to dedicate resources to at that time. When this background risk, especially for coronavirus, becomes very high,
Uh-huh.
then exactly like you said, Pete, you have to assume it is everywhere. And we're seeing that in the States right now.
Okay.
We've seen it in other countries, Italy, we've seen it in China and in certain parts of China. And it just spreads like wildfire. So I think that what you're saying, once the background risk is high enough where you're getting orders to do things like shelter in place,
Yes.
if you're still working, if the decision is made to still keep working with the corporation, definitely when you come home, everything is considered contaminated.
Okay. All right. Yeah. So that's it. So make the assumption that everything is contaminated because it probably is at that point. And
Yeah.
and I'd like to add something here just for a moment. Dr. Ahn has I follow the WHO medical reports every morning, and they have given him one of the highest ratings there is. They've spoken of him very, very highly. And for him to take time out to help us, help all of us in mining, in far as metals and refining and in dealing, is we just can't thank you enough. We really, really appreciate you taking time out of your frontline battle, which is what you're on. And thank you for taking the risks that you're taking. I know you have a family, and I know the work that you're doing, and I just wanted to say from all of us, we really appreciate you doing it.
Oh, thank you for those kind words, Pete. I mean, I think the WHO has recognized outstanding performers, including certain countries such
Yeah.
as
Oh yeah, absolutely.
and everything. But at the end of the day, everyone's in this together, and our miners who are going out and getting copper and getting metals that keep us going, right? I
Yeah.
mean, hospital's
Yeah.
not going to keep going without any copper running through it. So
Yeah, yeah.
keep
I mean, you won't have any lights in the surgical room without the copper and all the surface areas that the chromite men bring in and all of that. We are absolutely vital to that, and we appreciate you recognizing that as well.
Yeah. No, thank you so much.
All right. Well, Mr. Grant, thank you for running the show, and I think we'll sign off.
Very good. Thank you, gentlemen. It was a very, very interesting conversation. I enjoyed it immensely, and thank you both for taking the time to give us your insights. Thank you very much, Dr. Ahn. Thank you, Pete.
All right. Good night, sir.